Before we get into today's episode, I wanted to say a big thank you to today's sponsor, Revive Active, the original super supplement. 26 active ingredients to support your energy, immunity and heart health in one convenient sachet. Simple, effective, delicious. Their range is available in Boots, Holland & Barrett, Whole Foods and independent pharmacies and health stores nationwide, as well as online at reviveactive.com. Today's episode is with a wonderful doctor who I had the privilege of meeting at the end of last year called Dr Barbara Phipps. Barbara specialises in pain management, and her unique approach to how she helps people think about pain, process pain and work to manage their pain is really quite outstanding. I was so interested when I heard her speak, when I met her at the end of last year, and knew that I had to get her onto the podcast so that you could hear from her as well. I really hope you enjoy listening to what she has to say. I absolutely loved getting the opportunity to speak to her about her work today. Barbara, thank you so much for coming onto the podcast. I cannot tell you how excited I've been about speaking to you, because we met fairly recently, didn't we, at a lovely event in Scotland where you're based. And I was, I had the pleasure, but the sort of scare factor of you were presenting before me. And I was sitting there thinking, oh my goodness, this is just amazing. And I was so captivated. It was quite nice because it took me off my stress about my bit that I was doing next. But I was also thinking, how do I follow up on this? But I just thought, as I was listening to you speaking, I was thinking, I need to ask Barbara to come onto the podcast, because what you've got to talk about and that your approach to pain management, health, well-being, compassion is just outstanding, and I just want people to hear from you.
Oh, Nicola, you're far too kind.
I'm not at all.
I've obviously managed to con you very successfully.
No, not at all. Why don't you explain? Because you're a doctor, aren't you? A GP. You're also like you train doctors, and you sort of work in education as well as working as a GP. I've got that right, haven't I?
Yes.
But you've also been a real, just fantastically brilliant at setting up a specialist pain management clinic and groups in the area where you work. So I'd love to just have people hear a little bit about you and your background first, if that's okay, and then we'll get into pain.
Yeah, of course. And yeah, thank you so much for asking me to come on the podcast. It's a real pleasure. And I have to say to everybody listening that Nicola's talk was completely awesome. She blew it out of the park. And everybody loved it. So it was just such a wonderful event, and it was so lovely to meet you. Mm. So yeah, I'll tell you a little bit of background. So I am a GP, you're right. I've been a GP for quite a long time, as well the people on the podcast can't see, but with my grey hair. But I don't do a huge amount of general practice anymore, because for the last 5 or 6 years, I've been very much focused on helping people who experience long-term pain. So that's definitely my area of special interest, along with lifestyle medicine. So those are two little sort of specialist areas, if you like, that I'm really interested in. And yeah, you're right. I do teach at the University of Edinburgh, so both postgraduate and undergraduate. So I teach on the MSc in the clinical management of pain. And then I'm currently Deputy Director of Year 5 at Edinburgh University.
Wonderful.
So lots of different little roles, which is excellent because it keeps the week very interesting.
Yeah, and
juggling lots of balls and sometimes drop them as well.
Yeah, and that's okay.
You know what it's like.
That's okay. So, what got you into pain then? What was it that drew you to this particular area?
Yeah, so being a GP for quite a long time, you see a huge number of people who experience long-term pain. So, I mean, the statistics vary, but you're talking probably 20 to 30% of the population that experience long-term pain. And so people come in and they come to see you as their GP, and I will listen and I would give them medications, and off they would go. And more often than not, they would come back and might try different medications or increasing the medication. And then they would come back. And so people just repeatedly coming back, not getting any better from their long-term pain. The medications weren't working. You might refer them to specialists and they would try different medications or have investigations. And then they would still come back because things weren't getting better. And then there's that realization of, hang on a second, what I'm doing here is not helping. It's not working. People are coming back all the time. Surely there must be something better that we can do. And that just sort of sent me down this rabbit hole of learning all about long-term pain, about the neuroscience, about long-term pain. And then once you sort of put your feelers out, and then you start to meet people who have recovered from long-term pain or who have, improved significantly. And you think, okay, how did you do it? And then you just get into this whole world of learning about how you can improve. And that's where it all started. And then, okay, so how can I bring that into my practice? So we started doing some little group consultations within the GP practice. So my GP colleagues were so helpful, and were able to give myself and one of my colleagues like an afternoon off for sort of 6 weeks. And we invited all our patients who had long-term pain, and we got about, I don't know, it was maybe about 12 people who came, and we ran a little group with them, and it was pretty good, but needed a bit of work. And then we sort of got a little bit of funding, have got a collaboration going with one of the sort of voluntary organisations in the community, and we now run it together. So I'm funded by the NHS, and they're funded from their point of view from the sort of voluntary sector. So it's a bit of a collaboration.
Yeah, wonderful. And when you're talking about long-term pain, are you talking about things like fibromyalgia? Are you talking about pain from injury? Are you talking about back pain? Is it everything? Is it everything that you were seeing and not finding that you were necessarily getting the results you wanted from the medication?
Yeah, I would say yes, but mostly conditions like fibromyalgia. So what's technically termed, well, there's a few different terms for it. So it could either be chronic primary pain, or the other terms that are sort of interchangeable are things like nociplastic pain or neuroplastic pain. And what that means is that the person is experiencing real pain, but there's not any underlying structural reason within the body that can explain why that person's experiencing the pain they are. So fibromyalgia, like you say, is a really good example. Having said that, we do get people in the group who might have inflammatory conditions as well. So they may have rheumatoid arthritis and fibromyalgia, or they often have back pain, or they might have migraine. But they are people who have had long-term pain. So that means long-term by definition, or chronic pain by definition, is just pain that you've had for more than 3 months. But mostly it's people where there's not really any underlying structural problem.
Yeah. And I'd love to get into like how you're working with people and what you're doing. But I think first, if you could explain what pain actually is, I think that's such a good gateway to then looking at how you're approaching it, because it's a fabulous way that you're working with people. And the way you were describing pain in the talk you gave that I listened to was just brilliant. What can you tell us about pain? What do we know about pain? What did we think we knew about pain, and what do we know now?
Yeah. So that's a really good place to start. So I think as a culture, and even really still in the medical profession, we have always assumed that, or always thought that if you have pain, then you have to have something structural going on within the body. There's got to be an injury, or there's got to be an infection, or there's got to be a tumor or something like that. And that's the way we still imagine pain to be. But that theory of pain, the sort of structural tissue damage theory, is actually it's from the 1600s. It's really, really old. And what we now know is actually pain is produced by your brain. So it's always produced by your brain, whether you've got a toe fracture or whether you've got a tooth abscess or an appendicitis. It's your brain that is generating the pain experience. Yeah. And the brain produces pain when it perceives or believes that there is something out there that is a threat to your health and well-being. Now, it could be a structural threat, so it could be an infection or an injury, of course, but it could be any sort of threat. So if you think of all the threats that we have around us, so it could be that maybe you're a terrible sleeper. Maybe you haven't slept well for years. That's a threat to your health and well-being. Your brain knows that, and that can generate a painful experience. It could be that you've got so many stresses in your life. That's a huge threat. It could be that you've experienced threats in the past. So it could be any threat. It could be social isolation, because that's a threat. And any of these factors can trigger a pain experience. So it's really, so when we look at somebody who has long-term pain, yes, you've got to make sure that there's nothing structural. That's really important. So you have to have those investigations. But if they come back and there's nothing structural, then we have to think, okay, what else is going on in that person's life? What other experiences have they had? Because those kind of things, those social factors, psychological factors, sleep, lifestyle factors, are all hugely important, and we tend to miss them.
Yeah. I really like the use of language where you're saying pain experience. It's actually it's a good way to maybe frame it, isn't it? Because it slightly changes it somehow for me, how
That's really
I'm thinking
interesting.
about it. Do
Yes.
you know?
Yeah, no, absolutely. And it's interesting because the definition, okay, so there's probably lots of definitions, but the sort of definition from the International Association for the Study of Pain, which is kind of like the agreed definition of pain, is that pain is a sensory and emotional experience. And that experience can be associated with tissue damage, but equally, you can still have that experience without tissue damage. So that's basically what it says. So often what I say to the people who come to my group is I say, look, pain is an experience. So if we can help you to improve your experience of your pain or of your symptoms or your sensations, then they will improve. If we can improve the experience, that will improve the sensations, because they are the pain is the experience, if that makes
Yeah.
sense.
Yes. And I think it's really nice, because I think a lot of these conditions like fibromyalgia and so on, where you can't see a physical
Yeah.
thing, there is that sort of, oh, just get on with it, or you're making it up, or it's in your head or whatever. And actually, okay, maybe to an extent it is in your head because it's your brains. Your brain is right, but it's not that you're making it up. It's a genuine physiological trigger. There is some sort of a trigger that's making the
Absolutely.
brain react in this way and behave in this way.
Absolutely. I mean, basically, the brain, and if somebody's experiencing long-term pain, their brain is doing exactly what it was designed to do. It's
Yeah.
doing exactly what it should be doing, but it's almost gone. It's too good at it.
Yeah.
It's gone a little bit too far, so that it then becomes hugely overprotective of you. It starts to perceive danger everywhere, and then stops you from doing stuff
Yeah.
because it perceives them to be dangerous.
Yes. And if you were to have like a pain in your body that maybe even from an actual physical injury,
Yeah.
what do you think about, that the fact that once the injury is healed, the brain is still remembering that pain, and you can
Yeah.
almost change even the way you move. And so that creates knock-on new challenges for the brain to perceive new danger signals, doesn't it?
Yeah. So, I mean, your brain, the most important priority for your brain above anything, and it does so many amazing things, but the most important priority is to keep you alive, to keep you safe. So it will always err on the side of caution and go above and beyond to keep you safe, rather than underplay it and potentially risk you coming to some sort of harm. So say you do an activity like you go out to the garden one day and you develop back pain when you're weeding, And then you maybe go out the next day and you develop back pain again. And on the third day, when you actually even then think about going into the garden, before you've even got into the garden, you're developing back pain because your brain's going, hang on a second. Do you not remember that the last 2 days that you've gardened, you got back pain? I don't want you to go and garden because it's dangerous. And therefore, to stop you from doing something that it perceives as being dangerous, it will produce back pain because it's remembered, just like you were saying, it's remembered that activity, well, it caused you back pain the last time.
Yeah. Yeah. Let me tell you something really fascinating since I met you. So I had a not very nice injury this year anyway, at the gym, and it's definitely healed because enough time has passed and I've done the rehab work. Okay. Right. But what I started noticing after meeting you was when I get out the car and I start walking towards the gym, the pain starts to occur.
Oh, no way.
Yeah. So it's so interesting. And it's only light, right? Mm-hmm. And so what I was doing before hearing you speak was I was thinking, oh no, there's that pain. I'm going to have to warm up really well. Mm-hmm. I'm going to have to, God, that's fascinating, right? I'm going to have to think about that. Now what I do is I go immediately, I say, oh, there's that pain because it's scared. My leg is scared of going in the gym. Yeah. And I say to myself, but actually I'm not in pain. And the pain goes immediately.
No.
Yes.
That is, isn't it amazing? And it's based, and it's so lovely because basically your brain, you don't want to get angry at it because it is trying to protect you. It's really looking out for you, Nicola. And then what you're saying is, oh, thanks, brain. Yeah, thanks a lot. I see what you're doing and I see you're looking after me, but it's okay.
Yeah,
it's
the gym's okay. The gym's a safe space.
Exactly.
Yeah.
And then it goes, oh, that's okay then. Thanks, Nicola.
Yeah. And
how lovely to me.
Yeah, and how lovely then for me to not have that pain as I walk through the door, because from walking to the car to the door of the gym, I'm having this scenario happen. So it's happening happening within like a couple of minutes. Isn't it? Honestly, I love the brain. I just think it's so amazing.
It literally blows my mind. I think in my next life, I really would love to come back as a neuroscientist because I just find it so interesting.
Yeah. Well, there's still time, Barbara. You can do a side hustle.
No. I don't think I've got the brain capacity.
So in terms of then, so if you're working with someone or someone's listening to this and thinking, right, I've got fibromyalgia, I've just got chronic pain that I've been living with. What would your advice be? Like, where would people start? You know, because a lot of people, pain is such a debilitating thing. It brings you down. It makes you feel really depressed. Yeah. Makes you really low. It makes you isolated. Yes. It stops you from doing what you want to do. What would and I think some of the pain medications, unfortunately, they can affect your digestive function. They can, they're not, some of them can be quite challenging in terms of feeling like you're, keep needing to take, they're sort of that there's that sort of potential addiction spiral, I suppose, sometimes, isn't there? Where would people start? What would you suggest?
So the first thing I would say to somebody who's experiencing pain, there's 3 things. I say, look, if you don't hear anything else that I say today, I just want you to remember 3 things, okay? Your pain is real. It's absolutely real. And if you have ever been made to feel that it's not real or it's all in your head, then I'm really, really sorry because it's not. And whoever gave you that impression is wrong. So your pain is real. It's not your fault. You haven't done anything wrong to have this pain. In fact, as I said a few minutes ago, basically your brain's just doing what it's designed to do, but just a bit too well and a bit too much. Mm-hmm. And the third thing is that it can improve. It absolutely can. So again, if you've had the experience where you have had hope removed, then I'd like to give you some hope back because it absolutely can improve and we could dial it down. And then a little bit about what you said a minute ago about how unpleasant the whole pain experience is. So I say one of the things is that, a bit like the story you've just told as well, is your brain's trying to tell you a message. It's trying to tell you that there's something out there that it's a bit scared of. And maybe it hasn't been getting the response from you that it wants. So you've given your brain a lovely response by going, thanks very much, but I'm okay. So I say to people, if you had to say some words to explain how you feel about your pain, what would you say? And they're words that similar to what you've just said. It's horrible. It's really frustrating. They feel very sad, maybe a bit depressed, pretty angry about it all,
Yes.
really angry. Maybe there's some grief in there as well about the life that they used to have, pretty anxious about stuff as well. What's the future hold? It's all a bit frustrating. There's a lot of fear around. It might be fear of having the pain, or it might be fear of movement or whatever. So a lot of really sort of negative emotions, which are like, of course you do, because it's really
Yeah.
unpleasant. So everybody would feel the same way. And then I say, okay, so your brain's feeling a bit scared. It's noticing that there's some threats out there. And those emotions that you feel, completely valid as they are, but are they going to make your brain feel more safe or less safe? And they kind of go, okay, yeah, less safe. I go, yes. So you've got this
Right.
experience where you've got pain and your brain is feeling that there's a threat out there. And then with the best will in the world, you have piled those negative emotions on as well. And of course you do, because you're just human. And your brain then feels more unsafe. So essentially what it does, it's like a megaphone to the sensation, and it makes it worse. So I say one way in, and there's lots of different ways in, but maybe the first way in is to see if we can help you change how you respond to your symptoms, how you respond to that sensation, and see if we can help improve that relationship that you have. And sometimes they kind of look going, in fact, I remember having one person, she's like, hang on a second, Barbara. So are you telling me that I should love my pain? And I'm like, yeah, okay, well, that might be taking it a little bit far, but maybe just not hating it quite so much, and maybe just allowing it to be, not fighting through it, not resisting it or pushing it, but maybe seeing if you can just even find a place of acceptance first. Is a good place to start. So yeah, maybe not loving it, but then at the end of the program, so it's a 6-week program, I said, so like, do you love your pain yet? She was like, okay, so I don't love my pain, but I don't hate it.
Yeah.
I'm much more accepting of it. And for her, things had really improved. I think life had just got bigger.
Yes, yeah. And these benefits are also cumulatively beneficial. If someone's working with you for 6 weeks and they take on what you're saying and they continue to work with it, I imagine that as the brain, everything calms down, the nervous system calms down, then that experience it's like an accumulative benefit, I would
Yeah.
imagine. Would
Yeah.
is that what you see, or?
Yeah. Oh,
Yeah.
absolutely. I think, 6 weeks is such a short time. So you're really just getting the process going. Now we're setting up a little wellbeing cafe for people who've been on the program, and we've got some lovely volunteers now, like who've already been on the program, who want to come back and help with the wellbeing cafe, so that they can help other people who've finished the program, so that we can keep that connection with people and have that ongoing support. Because 6 weeks is nothing really. It's just you're giving them the tools, but then it's about going out there and really starting to embed those tools, bite-sized chunks into your
Yeah.
life. And
Yeah.
the thing is, it's good for pain, but it's actually just good for life, these tools.
Yeah. So what you're talking about then, is it mindfulness? Is it visualization? Is it
Yeah,
meditation? Is that kind of is that the lens that you're looking
yeah,
through when you're dealing with pain?
yeah, absolutely. Those are 3 really great tools. So anything essentially that calms your central nervous system. So if you think of the brain being in chronic pain, being in a bit of fight, flight, freeze response, then anything that calms the central nervous system will be helpful. So absolutely. A mindfulness technique, one technique that we use, it is essentially a bit like mindfulness, and it's called somatic tracking. So somatic meaning body, tracking meaning, well, tracking just gently. So you're very calmly, you breathe slowly, and you start to, rather than fight against the sensations that you have and push them away, you're allowing yourself to sit with whatever sensation you have, calmly observing what that sensation is, where it is, what it genuinely feels like, not what your brain is thinking and what stories it's telling you, but actually paying attention to what the sensation genuinely feels like in your body, putting some words to it, noticing where it is. Maybe there's a color associated with it, breathing calmly. Because if you're fighting a sensation, if you are frustrated with it or pushing through, then it's reinforcing to your brain that that sensation is dangerous, because you don't fight something if it's nice. So if you can allow yourself to sit with that sensation, in this case, pain, if you can allow yourself to sit with it calmly and breathing, just noticing it, then you're basically saying to your brain, this is okay. This sensation is okay. It's all right. It's not scary. So thanks very much, but I don't need you to protect me. Yeah. And then you're starting to form new little neural pathways. So that is a really good, I had one lady and she called it Somatic tracking. It was so cute. And it takes a bit of practice, like
I was just going to say, yeah. You've got some lovely, if you don't mind, I'll share them on the show notes. But you've got some lovely YouTube recordings, videos doing just this, which I think is so fabulous. Yeah, I imagine these things are actually quite hard to do. I think it's a bit like any of this mindfulness or what you're describing. There's a lot of thought that has to go, especially if your narrative for so long has been, a different story that you've been telling yourself about the pain, or it's very easy to allow it to become diverted during these sorts of processes with thinking about other things, or going to where you've the thoughts associated with the pain. But I guess it's the more you do it, it is like any other form of training, isn't it? Learning a new skill at work, learning a new computer system, going to the gym and working on a particular thing to get stronger. Any of these things, it takes some time, doesn't it?
Oh, absolutely. And you know what? I mean, I am a rubbish meditator, so I'm not going to sit here and say, look, I'm really good. I genuinely don't really meditate, as in I don't sit down, but when I'm in nature, I'm meditating, and I try and do the 5, 4, 3, 2, 1, where you 5 things that you can see, 4 things that you can hear, 3 that you can touch, etc. And literally, when I get to number 4, I'm thinking about something else completely. And then I have to pull myself back. And I'm constantly pulling myself back into the present.
Yeah.
So, yeah.
But that's what it is. Half of it is just noticing.
Yes.
Isn't it? It's noticing and pulling yourself back. That is it. That is the job done.
Yes.
And I think that can be quite freeing to know it's not that you have to be thinking something in particular. It's just that awareness and catching. I often talk about,
here I go again.
Yeah.
Thinking about what I'm having for dinner tonight.
Yes. Which I would say is a good thing. Because I often refer to it as like, I say to clients, it's like you want to walk alongside yourself during the day. You're just walking alongside yourself, because I'm talking more about food really, and how people are thinking about food, or how people are responding to their thoughts about food or whatever. But this is the same sort of thing, isn't it?
Oh, totally.
And I guess the more you do it, the more enlightened you become, and the more exciting it is to be sort of, approaching it from such a positive angle, actually, such an angle of empowerment, really, agency.
Yes, absolutely. And just, you were talking there, which is so important, about noticing your thought, So there's a guy in America, he's absolutely brilliant. He's called Howard Schubiner, and he's a real sort of guru when it comes to long term. He's just lovely, so lovely. And he said that basically there's 6 F's that fuel pain. And I'll probably forget some of them, but basically it's like fighting through the pain, focusing on it, getting frustrated by it, trying to figure it out, trying to fix it. And I've completely forgotten what the other one was. Anyway, you get the gist.
Yeah, I can only think of a swear word at this point to do with it.
It begins with F. I usually say to people, I'm sure you could add on some more F's if you like. And I said, okay, notice yourself, because you will notice these F's coming up. You'll notice yourself focusing on it, getting frustrated by it, fighting through, and being aware of when you're doing that. You think, there I go again. Then you can start to change the way you respond.
Yeah. I sometimes find that it helps people. I'd love to know what you think of this, because that's sitting and thinking or walking. I think movement for a lot of people is very, very beneficial. And when I talk to clients sometimes about them noticing a thought, actually physically turning away from it. So if you're sat at your desk and you're having a thought about something, actually picking up on it and actually then going, no, and physically turning your body, turning away from that thought, that can actually be quite helpful.
Wow. I think that's wonderful. I think getting your body involved in it, so that it's not just your head telling you stories and going on, actually really allowing your body to get involved. And yes, that's a really lovely thing to do. It gives you, I think, again, that word agency. If I'm moving away from this.
Yes, yeah. It's the brain is just, I can't. I mean, for me, even you saying, and now that I'm saying it, have heard you say it now, I feel silly for not sort of thinking about this or thinking this through before. But you saying, the pain in your toe, it's not actually the pain is coming from the brain.
Yeah.
I think that is it's pretty remarkable, because you and even just knowing that one thing, I think even just those small snippets of fact make it easier to start making a change, because you're then immediately seeing it differently.
Yes.
I
mean, it was quite interesting. I got up one morning, it wasn't that long ago, and I went to the bathroom and I stubbed my toe. So I think one of the F's came out, one of those other F's. And then I was like, no, hold on a second, Barbara. You've got to do, practice what you preach. So rather than sort of going, and jumping all around the place with my sore toe, I started to breathe really slowly. And I observed the sensation that was happening. And I just noticed it, and I breathed slowly, and I literally couldn't believe that within about a minute or two that had completely gone.
Wow.
And I thought to myself, I bet you if I jumped up and down and held my toe and gone, it would have lasted for longer. Obviously it wasn't too severe. I do realise that people experience a lot more than a stubbed toe. But I just thought, wow, that's quite interesting that I was able to dial that down.
Yeah. Do you know what that also makes me think? Again, sorry to talk about food again, but that's what I do.
But food's really important when it comes to pain as well.
But I'm just thinking, like, a lot of the time with our relationship with food and how we feel about food and the messages we have about food, it's because we've observed in our formative years people's behaviours around food. And I also, part of me is wondering, listening to you, is again, if with our children, if they are seeing us responding quite inflammatory actually to pain that we're experiencing, do you pass? Does that cause? Does that actually create? It's
Yes,
you know,
absolutely. So definitely, if you're saying pain in somebody else, you can respond to that pain as if it's almost happening to you. So you
yeah,
definitely learn, don't you, from what you
yeah,
see. So
yeah,
if you have, it's quite interesting when you think of a child, if a child falls over, like your child, and you'd start jumping all around going, oh my goodness, are you okay? You go, oh, awful, awful. Then they'll probably start crying, and it'll be horrendous, and the pain for them will be much greater. But if you're very calm with them and you say, oh, look, it's not too bad, you're really brave, well done, soothing and
yeah,
reassuring, then they'll be fine. So they do
yes,
learn from you, definitely,
yeah,
about your
yeah,
response. They take
yeah.
their cues from you.
Yes, yeah. Oh,
Yeah.
this is so interesting. What else? Is there anything else that you would suggest for people to do so to begin with,
Yeah.
thinking about their experience of pain at the moment, maybe
Yeah.
writing it down even, or what would you,
Yeah. So
how would you,
I think, yeah, so I wouldn't necessarily write down about your pain, because what you're trying to do is trying to get them away from focusing
yeah,
about it.
okay.
I mean, so what would I do next? So, what you want to, I would look at the pillars, if you like, the pillars of lifestyle medicine. So asking them about their sleep, about how much, what their physical activity is like, what their social connection is like, what their nutrition is like, and really looking at those pillars of health, what their stressors are. Of course, that's a big one. So you're trying to help them change the response, but then you want to know what's driving the pain as well. So what kind of things are going on in their life, whether it's, probably a combination of loads of things. Is it sleep? Is it stress? Is it that their lack of movement isn't helping either? So what are those lifestyle factors, and where can we start to make improvements, or where can we help you to start making improvements?
Yeah, yeah,
So if you think of like physical activity, for example, of course, if you're in pain, you kind of stop moving, don't you? Because, well, it's sore to move. And yet your brain then will learn that physical activity is dangerous. And so you start to be able to do less and less. And again, it's that overprotective part. The brain is becoming overprotective. Don't do that. Don't do that. That's dangerous. And it's about then teaching the brain that actually movement is safe. My joints and my bones and my muscles are fine. So I need to start re-engaging. You gradually just start to move a little bit more. And I mean, you're not going to try and get somebody to run a marathon, but it's just moving a little bit more, preferably outside in nature, because it's so calming. And then reassuring your body that you can't do that. You
yeah,
can do that movement. That movement is safe. And then the brain starts to learn that those activities are safe again. So it's just gradually reintroducing life again. So people often say, over the years, oh, I'll start to re-engage with the clubs I like to do and the sports I like to do and everything when my pain is better. And I say, look, that would be, in an ideal world, that'd be great. But actually what we've got to do is we've got to flip that upside down. Because if we can make your life bigger, or help make your life bigger, if we can get you re-engaged and meeting your friends again and going out to the clubs that you used to do, then actually that will start to dial down your symptoms.
yeah. That's that again.
So
That's
it's
just
the
yeah,
reverse.
yeah, yeah, yeah. Are you noticing anything like do you notice anything from a nutrition perspective? Are you doing any tests with your patients on things like standard sort of nutrient testing, like vitamin D or anything like that? Are you doing any of that stuff, and are you seeing anything there?
Yeah, so not in the group that I run. In the groups that I run, where it's sort of in a little community, so there's no blood testing. I think many of them will have been referred by their GPs, but I actually don't know the answer to that. That's a really, really good question. We talk much more sort of generally
Yes.
about sort of healthy eating, that more focus really on the sort of like a Mediterranean style diet, or essentially I try and keep it quite simple and sort of
Yeah.
cutting down ultra processed foods, to be
Yes.
honest, and
Yes.
making really simple swaps. And it's really interesting because I remember a young guy and he wasn't sleeping very well, but then it transpired that I think he was a bit of a gamer actually, and he about midnight or something, or 11, he was having a bowl of Lucky Charms. I don't know if have you
Are
you know
they
the cereals?
cereal?
Yes, yeah, cereals, and they're all like different colours.
Yes, yeah.
And we were like, okay, well, maybe one thing that you could do would be to stop having the Lucky Charms at midnight. And he did. And it really helped us sleep.
Yeah, funnily enough.
And you're
Yeah.
like,
Yeah.
and you're thinking, well, that was one small thing that you could do, and it made a really big difference.
Yeah.
And then we do talk a little bit about eating windows as well. So not sort of just constant eating through the day, but maybe having an eating window. So even if you could do 12 hours, that'd be great. 8 at night, 8 in the morning.
Sorry.
Oh,
Sorry about the cough. That was coming for about it was coming for about 3 minutes, and I was thinking, hold it in.
You hid it really well.
Where's the water? It's because I was running late. I don't have the water. That's brilliant. Is there anything else that we haven't covered? Because this is such a big area. I just think this is like tip of the iceberg, really. But is there anything else that you would say would be really useful for people to consider when it comes to their pain, like beyond what we've covered already? Is there anything else that you have found is useful for people? Or so
it's quite interesting, because very often, and maybe if some of your listeners, if they have experienced or do experience long-term pain, that it doesn't come alone. So it's got a lot of pals, has pain, and its very good friends are fatigue. So it really, often comes alongside long-term fatigue. People can experience brain fog. They can have other diagnoses such as hypermobility, or POTS, which is postural orthostatic tachycardia syndrome.
yeah.
So lots of tinnitus, of course, not all of, there are other causes for these things as well, but often people will have an array of different sort of conditions. And food intolerances is one as well. So often people will come to the pain service, but they've also got, sort of what they perceive as sort of intolerances to various different foods. And what I kind of try and explain as best I can, and I'm a very simple creature, so I really like simple explanations, is that your body is a bit of a team. So it's a team of different systems. So you've got your nervous system, like your brain and your nerves, and then you've got your digestive system, so your gut and your stomach and what have you. You've got your cardiovascular systems, that's your heart and your blood vessels, your endocrine system, all your hormones, your skin is another system. So you've got all these systems, and they're a team. Okay, so they're like a football team. And if your immune system, could we possibly forget that? And if you have one member of your team who's under threat, and that could be your immune system, or it could be your digestive system, or whatever, then the other members of the team don't just sit back and go, all right, pal, you're on your own. Absolutely not. They all get defensive as well. So the other members of the team get their defenses up as well, which is why, you get different symptoms in different systems.
Yeah.
And then what you're trying to do is, okay, so all these systems have got their defenses up. So how do we get in there? Now, we could maybe get in there by changing our diet and trying to help go in through the digestive system, or we can go in through the nervous system and try and calm the central nervous system. Or we could actually do all of those together.
Yeah.
We can use them all together, because ultimately, if one system, if the defenses go down, then the others will feel a bit safer as well, and they can sort of put their defenses down. So quite often what we'll see is that if people who are experiencing pain use some of these techniques, calming their central nervous system, then their gut will improve as well.
Yes.
And they might find that they can start to tolerate some of the things that they couldn't do before. Or they might find that actually your cardiovascular system isn't quite so defensive, so the POTS symptoms can improve as well. And actually, maybe that brain fog, because I'm coming out of fight, flight, freeze, which can, enhance brain fog because the prefrontal cortex of your brain shuts down. Then actually, if we can calm that, if we can improve that, then the brain fog can improve as well. So it's like you're trying to address all of these, all the defenses can go up, and we can sort of start to improve and calm down the response from all these parts of the body, all these members of the team.
Yeah. Oh, this is wonderful.
Yeah.
You're fantastic. Well, how can we get you out into the world, Barbara? We need to.
I don't think the world could cope.
Well, what's a shame is that you're in. For me, is that you're in Edinburgh and you're working in your area. It's challenging, I guess, for you at the moment to be working with other people outside of your area in Edinburgh. Is it, or is there any way that people could work with you?
Well, honestly, I love talking about pain. I think when I'm really quite sad, I'm quite a sad person. I find it so interesting. I could talk about it all day. So I do love, like last week, I went over to Belfast, which was lovely because I got to see my mum as well. And I went to like a GP conference and I was talking about pain as well. So that's the kind of thing I do love doing it. And I do love talking about it because, well, it's just really great to get the message out.
Yeah.
I think that hopeful message, you are much more powerful than you give yourself credit for.
Yeah.
You have got the skills within you, and you just might need a bit of support and a bit of knowledge and a bit of help to do that, because it's not easy. But
yeah, so I guess your way is that because you're working in these more academic circles, you're setting these things up. You're also you're a member of the British Association of Lifestyle Medicine.
Yeah, the British Society of Lifestyle Medicine.
So I guess you're championing this message through the medical community in the hope that will filter out. Is that kind of
absolutely. I don't do any sort of private work. I haven't really got any time anyway.
Yeah.
But I think actually I'm not alone. Do you know, there's some really, really great doctors, physiotherapists, nutritionists, all really, really interested in pain, and the kind of movement, if you like, is growing. So it's the perception and the management of pain is completely changing, which is great, because it absolutely has to. And I just feel we're really getting there, because I think up until not that long ago, there wasn't the sort of randomized controlled trials and everything to sort of support interventions, but they are coming, and there's been a couple of really, really good trials that have shown how changing your response to your pain, learning about the neuroscience around pain, can have a huge, huge beneficial impact.
Yeah, it makes total sense that it would. It's really good that they're providing the evidence for that. That's wonderful. So people can go onto YouTube, can't they, to look for your the somatic
tracking. I think I just got about 4. I mean, I only did it recently. I was so incredibly proud of myself because I'm such a complete technophobe. I managed to even upload anything onto YouTube.
They're really good. They're really good.
Well, you're very sweet. They're quite simple, but I'm a simple creature.
But that's what we need.
Well, it is simple. Yeah, the little technique. I'm not saying it's simple, but yeah,
making it simple, making it easy. And again, that helps the brain to feel safe. Surely.
Yeah.
All of this
absolutely.
all of this hacking, all of this sort of wellness, sort of hard worky wellness stuff that looks easy but is hard, taking all these things, doing all these things, factoring all these things into your life, that possibly is very, very stressful for the body in itself. So I just think a bit of simplicity.
It is. I think simple's good. I really do. I think definitely. And that's certainly for me. I remember things if they're simple.
Yeah.
And these are things that you can do, and they don't cost a fortune. You do not have to spend loads of money. The best medicine, I think, is getting outside in nature and having a nice walk, eating healthy food and meeting up with friends. those kind of things. Those are really important. And I mean, there's some great books if people are interested in reading. I've got a few just of my top books. The one that we give to all the participants who come to my group is called The Way Out,
right,
by a chap called Alan Gordon. It's brilliant. There's a chap Alan Gordon's, he's an American neuroscience. Well, I think he actually had chronic pain himself, chronic back pain, and now he's a researcher into chronic pain. And the book is brilliant. I think a lot of my colleagues have said it's one of their favourites. There's a guy also who is he is a medical doctor. I think he's in Oxford. He's obviously got the brain the size of a planet. He's called Monty Lyman, and he's done a couple of really good books. One is called The Painful Truth, and the other is The Immune Mind. There's another book called The Expectation Effect by David Robson, which is all about, you would love it. If you haven't read it, oh my goodness, you would love it. It's all about how, what our brain predicts and what it expects to happen, even if it's completely incorrect, really influences what actually does happen physiologically in our body.
Yes. Yeah. Oh, I'll get that book. That's
so good.
Yeah, fantastic.
But there's some other great books, I've got there's just some lovely ones. I've got a whole array back there.
Well, you can send me a list if you want to, and
yes,
I can put
yes,
I can put that down as part of this. Yeah. Oh, Barbara, it's just been just wonderful talking to you.
Oh, you're so kind. I'm so silly, Nicola. Too kind to do me that.
It's been absolutely wonderful speaking to you. I'm really, really so happy to have connected with you.
So am I, Nicola. It's been so lovely.
Yeah, and hopefully we can work together and do another mini retreaty sort of thingamajig at some point in the future. But thank you so much for giving us your time today to share your wisdom. It's much appreciated.